Now what I would like to go ahead and cover is what actually microdermabrasion is and how it can benefit your salon or your spa. Microdermabrasion has been around now for about 13 years. The very first machine that they ever came out with was called the Pepita. It was a machine out of Italy. And over the years, technology has just gotten better and better and better, and it's been easier and easier for us as estheticians to use. Nowadays, you do want to be a board-certified esthetician to utilize this machine. This particular machine, in general, I personally feel is superior in regards to the type of crystals that you use with it. They're Class 1 medical grade crystals. Microdermabrasion itself, a lot of people ask is, well, how is it going to benefit my clients? How am I going to incorporate it into my spa? How am I going to incorporate it into my daily facial routine with people? Microdermabrasion is specifically designed to help with pigmentation irregularities, tone, texture, pore size, acne, slight acne scarring. Over time, because of the vacuum mechanism with this, it helps with the circulation, so it can help with some collagen remodeling of the skin. This particular treatment itself is something that you do want to really encourage your clients to stick with. If someone decides to come in and have one treatment done once a month, that's perfectly fine. Are they going to see results? Yes, their skin is going to look more youthful looking, more translucent, it's going to have a nice glow to it, and it's going to clean them up really nicely. What I encourage my clients to do is for their first 6 to 10 treatments is promise me that they will come back and see me, but every 7 to 10 days we'll do a treatment, and every time they come in I just keep turning up the intensity a little bit more and a little bit more to get the blood flow going. Microdermabrasion is a manual exfoliation of the first very superficial layers of skin. A lot of people think, oh, I'm going to bleed and I'm going to peel and I'm going to have some blistering or this or that. This is not a chemical breakdown of the skin. This is very, very easy. I have people come in on their lunchtime to do this. They put their sunscreen moisturizer on, put their makeup on, and walk right back out the door, and they look great. I do want to reiterate, though, and keep in mind when you talk to your clients about this, there are certain people that are not the most ideal candidate to have microdermabrasion done. And obviously, you do need to use it at your discretion. I personally have found some individuals that have very sensitive skins. You can go ahead and treat them, but you do want to keep it at a lower intensity level, and you probably don't want to move them up a whole lot. If someone comes in with a lot of active acne lesions, I usually like to stay away from that type of individual. I will go around the acne lesion itself, but I will not actually run the microdermabrasion machine over it. A lot of people ask, can I do this around the eye area? That's usually our biggest complaint. We don't like the crepiness underneath the eye. With this particular machine, you have a choice of different size portal holes. And there are smaller ones and there are larger ones. And you can opt to change it, and you can go around the eye area, which is really nice. When we do our treatment on our client, I'll go a little bit more in detail as to the consultation itself. You'll hear me ask specific questions that will kind of dictate what kind of treatment plan I'm going to be doing for this client. So to reiterate, Microderm has been around for years. It's very safe. The crystals that we use are considered medical grade. It can help with fine lines, tone, texture, pigmentation irregularities. You can also use it the neck, the décolleté, the back of the arms. You can use it on the feet if you want to. There's a lot of different places you can use this. It's got multiple usage for modalities. So in general, Microderm is great for just about anyone. If someone does come into you that has been diagnosed with a specific skin issue, I would probably defer that patient or defer that client to someone else. So once again, you need to use it at your discretion. Microdermabrasion I have found extremely useful in my practice. Anyone that comes in with acne, wide variety of different ages come in and see me. What I do like to point out is that a lot of people can benefit from this treatment. When we talk about the first type of patient that comes in, we'll talk about an acne patient. I have anywhere from teenage acne, adult acne, middle-aged acne, just dry skin. Someone is on a topical agent that is maybe making their acne a little bit worse and they want to try and clean it up somehow. This is the treatment that you want to incorporate into their therapeutic healing. If someone comes in to see you for a facial, or say an acne facial, usually what I like to try and do is do a really good cleansing on them. Follow that with a real good microdermabrasion treatment because it will help to unclog the pores if someone comes in that has comedones or blackheads or little tiny milia that you know you can get rid of with the microderm machine. I like to do that. The other thing that this is great for too is just very, very superficially and microscopically removing some little layers of the epidermis, which is really nice, whereas a lot of the bacteria is held. So by getting in there and removing some of that, you're also stimulating the dermal layer to start producing newer cells to move up to the surface of the skin a lot faster. So there's a definite benefit to do this. Another kind of patient that I see on a regular basis is someone that's in their mid-30s, early 40s, and they want to look to freshen their skin. They've got some dry patches on their face. They might even have maybe a little bit of cuprose skin or some flushing and blushing of the skin, which is pretty normal. Pigmented lesions here or there. This is great. Why not do a hydrating facial on that person to really hydrate the skin? Do a manual exfoliation with the microdermabrasion machine just to get all that dead skin off of the epidermal layer. Once again, it'll stimulate the dermal layer. And then finish them off with some great antioxidant properties, and you'll hook that patient, and they will keep coming back in because they're going to notice their skin is looking better and better and better. When someone comes in that has a fair amount of pigmented lesions on their face, whether it be just sun splotches or mottled hyperpigmentation, or if someone's on a medication that makes them more sun sensitive, you have the availability to go back into particular areas on the face and keep kind of gently microderming that area until you get a nice little erythemic or pink color to the skin, which is good. It will actually benefit the patient in the long run. Once again, because all that pigmentation irregularity is held right in the epidermal layer. So once you can get in there and start peeling that stuff off like the layers of an onion, then as the newer cells move up, they have no pigmentation irregularity to it. The other type of person that I see is someone that is post-surgical procedure, someone that has a little bit more mature or dry skin, and they're really looking just to kind of tone things up, just freshen the skin in general, and just make themselves feel and look a lot better. Once again, incorporate it in by doing a really good hydrating facial. Follow it up with this. I would probably keep the intensity just a little bit lower because the more mature skin types, their skin is a little bit lax. So your technique is going to be a little bit different when you do that treatment. When I work on someone that has more mature dry skin, I usually always like to go over their face with this machine a couple times because you will notice that dry skin actually physically will be removed from the skin, which is what you do want to see in some cases. A lot of people ask, is that normal? Should I see that? In some cases you will, and in some cases you won't. And that's okay if you don't actually see the action of the epidermal layer or the little dry pieces of skin coming off. That's perfectly fine. What you will see though is that in more mature skin types, they will immediately turn red really easy. That's not a warning sign, it's not a panic, it's just that's part of the mature skin type or someone that's a little bit on the drier side. When it comes to acne scarring, especially in through the cheek area, the neck area, or even on the back, this machine is great. You can do, once again, do an acne facial with it, turn up the intensity on it, and really get in there and just plane down those acne scars. Some people ask, well, what kind of scars can this work on? It can work on a variation of different types of scars. However, they will never, ever, ever completely go away, but will they soften? You better believe it. Will the client be happier? Yes, they will. Will the client come back? Yes, they will. So once they start to see the results from this, you've got them hooked. There are some people that will just come in and say, I don't want a facial, I just want my microderm treatment done. That's fine also. There's a line of products that I do recommend that you use in conjunction with this because I personally find it extremely helpful that when you go in, and you do slightly remove the epidermal layer, you need to help to rehydrate everything. So whether it be with an antioxidant treatment, a recovery complex, and then also make sure that they do wear a really good sunscreen moisturizer. This will help them in the long run, and will make their skin look and feel better. Instead of having to take the major step of actually going in and having, say, aesthetic surgery or a major chemical peel, this is just a gentler way to get them to where they want to go. One other thing that I do like to reiterate to new individuals that are starting up with the microdermabrasion, it's very exciting, it's a fabulous treatment to do, and you'll get a multitude of different people that come through your door. But I do like to touch on a couple things that you will find in your operator's manual. There are certain individuals that are not the most ideal candidate for this. And when you look through your manual, it's listed underneath the safety operations. I'm just going to kind of quickly touch on some of these because I have seen these come through my door. And when I do see individuals that come through the door that have, say, a cold sore on their lip, I don't want to touch them. I want to wait until it clears up, because potentially, because we're getting the blood flow going, it can actually help, it can aggravate it, and it can cause it to spread. So you want to stay away from that. If people are on Accutane, that's a question that I always get for people that are treating their acne, and that is a wonderful therapy to treat acne. They say, well, I'm on Accutane, can I do this? I don't recommend doing that. You could use it at your discretion, but personally, I think most people would rather say, wait till you get through your therapy, you're going to go through a dry period, and then come back in and see me, and then we can talk about doing some microderm for you. Blood thinners are another big thing. A lot of people take aspirin, ibuprofen, lots of it on a regular basis, especially more mature individuals in age. Their skin is thinner. They will have more of a tendency to get what we call purpura on the skin, where the skin is so thin you actually might get tiny little bleed points. So if someone comes in and when you're doing your intake and they say, I do take blood thinners on a regular basis, I would probably stay away from that individual. If someone comes in that has active rosacea and they are on rosacea medication, that to me is not the most ideal candidate. Most people that have active rosacea, they will point blank tell you, I'm in an active state right now. This potentially could aggravate it and it could make it worse. From personal experience, you just don't want to work on anyone that has rosacea that's where it is active. A lot of people also ask, well, you know, what if I have an immune deficiency? Or what if I'm HIV positive? What if I have hepatitis C? I would stay away from someone like that. I mean, you are the operator. You are going to be working over someone, even though we do take precautions and wear, you know, certain protective clothing or goggles or gloves. It's just something that you want to be really aware of. And most people will tell you. The other thing that's on here too is dermatitis. Dermatitis is very interesting. You can work around the areas that have the actual dermatitis breakout. It primarily will show up in through the eyebrows or in through the hairline. You can work around that. That is perfectly fine. From a safety standpoint, you probably want to err on the side of conservative. There are some other ones in here that, as you read through it, most people, if they have a specific skin condition or skin disease, they will tell you, and you can always refer to this. But the main question that I always get is, I'm on Accutane, or I'm on doxycycline, or I'm on a really heavy medication to help my skin. And that's usually why I defer it out and say, come back and see me when you're done with your therapy and your routine.